Amniocentesis is a medical procedure performed during pregnancy to obtain a small amount of fluid from the amniotic sac. The amniotic sac and fluid surround and protect the fetus. Live skin cells from the fetus are shed into the fluid. An amniocentesis test is performed with ultrasound to guide the procedure and avoid harming the fetus. The fluid is obtained by inserting a fine needle through the abdomen into the uterus and withdrawing a small amount of amniotic fluid. Examining DNA from skin cells in the fluid can identify a genetic disorder or chromosome abnormality, such as Down syndrome. Amniocentesis is usually performed between the 16th and 20th weeks of pregnancy. When a woman is pregnant, her pelvis begins to tip backwards as the baby develops to balance the forward weight of the expanding uterus. As the pubic and tailbones move backward, the arch in the lower back increases. As the lower back arch increases, so does the curve in the upper back or thorax. The shoulders and head move forward and the chest collapses to balance the changing weight. All these changes can increase stress on the spine, exaggerating its natural S shape. Other muscles and ligaments can also be strained. Diastasis recti means separation of the paired rectus abdominis muscles, which run lengthwise down the front of your abdomen. This can occur during pregnancy when the muscles stretch to accommodate the developing baby. The connective tissue between the muscles stretches and thins as the enlarged uterus distends the belly wall outward. After delivery, abdominal fat can press outward because the muscles are still lax and weak. This creates a so-called pooch in the lower abdomen. A woman becomes pregnant when one of her eggs is fertilized by sperm. Normally, once an egg has been fertilized, it moves down a fallopian tube to the uterus or womb. It implants itself in the uterine wall and is now an embryo. In an ectopic pregnancy, the fertilized egg implants itself outside the uterus because damage, scarring, or distortion of the fallopian tubes leaves it unable to pass easily into the uterus. Implantation in a fallopian tube is called a tubal pregnancy. Or the egg may implant itself in an ovary, the abdomen, or the cervix. Whatever the site of implantation, an ectopic pregnancy cannot continue to birth. If the embryo continues to develop, the tube or organ containing it will eventually burst, a potentially life-threatening emergency. The risk of an ectopic pregnancy is increased by tube infections, surgery inside the abdomen, fertility medications at the time of fertilization, and a prior ectopic pregnancy. An ectopic pregnancy is usually identified during the first 5 to 10 weeks of pregnancy. Causing symptoms of abdominal and pelvic pain and vaginal bleeding, it may be confused with a miscarriage. How the developing cells are removed depends on their location and size.